Welcome back into Good Day Tulsa, everybody. We are helping out your eyeballs this morning here at the office of Dr. Terry and Dr. Jerry Lawson. Chatting with Dr. Terry Lawson this morning. It's good to see you again, sir.
Good morning. How are you?
Okay, I'm doing fantastic. I had no idea that dry eyes were such a problem.
Yes, it's one of the leading reasons why people go to the eye doctor.
Okay, and a great piece of technology that you're the first to have in Tulsa, it's called the Tear Lab. It's just over here to my right. What does this do?
It measures the tear osmolarity. It gives us a number that we can relate to the quality or quantity of tear. So it's a great tool to let us know if indeed you have dry eyes, and also as we treat the dry eye, if we're making improvement or not.
Okay, and I read that it said treating dry eye disease. I thought dry eyes was it's just something that happens whenever, you know, there are allergens in the air.
Well, there are several reasons for dry eyes. Number one is a lack of oil in the tear film. There's three parts of the tear film. The outer layer is an oil layer, and there's glands along the lower eyelid. They're called meibomian glands, and if they are infected, well, then they don't produce the oil, and so consequently you have dry eyes. The tears evaporate because the oil's not there to stabilize the tears.
Okay, and then I'm going to actually get my eyes tested right now. I'm going to bring in Julie over here who has the Tear Lab. Julie, what do I need to do? I just sit down. Okay, sit right here, and I hear that this is painless, so hopefully no amputation is going to be happening live on Good Day Tulsa. Julie, I have total faith in you. And so all you do, you got a little piece of...
Just a little test card there. Okay. And I'm just going to touch that to your lid there.
Okay, so do I just look up?
Straight ahead.
Okay, I'm kind of nervous.
Use my hand right here to...
So far, painless. Barely feel anything, and I probably shouldn't be talking right now. How cool is that? So the beep means that's good, I hope. Not that.
It means that it got enough tear.
So it got enough tear, and that is important because how much tear is needed to have an official test?
A very small amount of tears, about the volume that would be on a dot of paper after a sentence, a very small period.
Yeah. Now, what happened before the Tear Lab? What did you all used to do?
It was pretty much subjective, how the patient was feeling, also from staining of the eye, subjective classification on a scale of 1 to 4, you know, on the dryness. But this really gives us some hard numbers to tell exactly where you fall in the dryness there. So it's like diabetics have their number.
Yes.
High cholesterol, those individuals know what their number is. This will give us a number to compare for the dryness.
Okay, how do I know what my number is? Does it take a very long time?
It's already below range.
Below range. So I'm guessing that's a good thing, I hope?
Yes. Okay, so that means your osmolarity is in a good category.
Okay, and then what if it was not in a good category? What happens then as far as treatment's concerned?
Well, there are several options for treating. Number one, we first take the tear osmolarity lab, the Tear Lab, and that gives us a starting point, know where your tear osmolarity is, and then we'll do some treatment. Normally it consists of starting you with some drops, sometimes some oral medications to clean out the meibomian glands, and then we'll bring you back in a month and see if we're making progress. The beauty of this instrument is that it'll tell us if we're making progress before you as a patient would know.
Oh.
Okay? So you may not be feeling 100% better yet, but the numbers would be going down. That means we're on the right track. Stay on this treatment. And then shortly, you as a patient would start feeling better as well.
Okay. Now, does insurance cover this?
Yes, it is. As of January, it is an item that's covered on insurances.
Okay. Well, good to hear, Doctor. Thank you so much, and thank you for testing my eyes, Julie. I feel better about my eyeballs. Thank you, sir.
Well, thank you.
Okay. And again, all you have to do is come in and get a test. You're just looking for that good number to make sure that your eyes are doing okay and that your tear ducts are working. Everything's perfectly fine, guys.
I think the neat thing about Vision Source, Kristen, is that they always seem to have the best in technology there. It's pretty amazing.
Keith, you're so good. It's like you're familiar with Vision Source or something.
That's where I get these on. Vision Source, 10 area locations, including 9102 South Toledo Avenue, 742-2055, VisionSourceTulsa.com.